So talking about that, how do you think that everything that you study and experience in your career helped you contribute to your view today?
Yeah, the one invaluable lesson I learned in Australia was to have a clinical mentor stand there and watch me treat a patient. And my person might had a classic radicular symptom from a lumbar disc, right? And he'd say, okay, so based upon what your findings are, what is it? What's the diagnosis? I said, well, it's a herniated disc. And he said, well, why is that? And what other reasons could it be? What other diagnosis could it be? And so there's that phraseology of phrase of what they call metacognition, the idea of self-reflection, was probably the most invaluable tools from a clinician standpoint, not necessarily like having love for neurodynamics or manipulation or motor control, but the ability to sit back and self-reflect of why did the patient not get better? It's not just because the patient didn't do their exercises. What could you have done as a therapist to do better to encourage them or to motivate them to do their exercises better? Or if the patient got worse, right? What did you do? Maybe you manipulated them in the wrong place. Maybe your technique was off. Maybe maybe it's a neurodynamic problem as opposed to a manipulation dysfunction, right? And so having that metacognition to look back and challenge yourself as a clinician to ask yourself, what could you have done better? Rather than the patient's not complying or the patient's got this problem, but put the onus on yourself as a clinician first to challenge yourself to become a better clinician so that the therapy can be more successful and the patient can receive more quality treatment. That's probably been the most beneficial thing I've learned. I challenge most, a lot of times medicine as a whole, therapists, doctors, sometimes we get that kind of white coat, phenomenon. We get this ego trip that we're, higher than now. Now we're doctors of physical therapy, things like that. You got to check your ego out the door. If the patient doesn't get better, check yourself first. Not to say you're the problem, but to make sure you're not just, casting that problem on someone else saying they're the problem. Make sure you've done everything you possibly yourself you can do, which means you got to keep learning because there's not one solution. So the more things you can learn and then apply it to the patient and know when to apply it and know how to encourage the patient to keep pushing forward with it is really kind of the secret sauce in my mind to actually keep moving forward with your clinical skills.
Yeah, I think it's like with all this background, as much as you go and study and learn new things, you improve your clinical reasoning, right? And then with your experience seeing a lot of patients, you probably start to differentiating better and like, oh, that's it, this is this. And I think just all the background that you have, it just adds up to that.